Everyone told me that once I'd have the baby, immediately I'd feel like a bond and a connection and a love that you've never felt before, and I just didn't have that. I think already it set me up for feeling, I guess, different to the other moms around me. That was really, really hard. And no matter how much I tried to relate to other people, I couldn't. I had gone through what I felt was a pretty traumatic birth. It was very different from my birth plan. It was hard to talk to each other about it, let alone talk to other people outside of each other. And that was really difficult for us. I think initially when I got into contact with the mental health visitors, I felt a bit lost. I didn't know if I was being a good mom. I didn't know if I was doing things right. I didn't know if this cloud that I kind of felt in my head would ever disappear.
Our service works from pregnancy right until a child's 2 years old, and we work with both mums, fathers and non-birthing partners. Our support's open for self-referral from your midwife, your GP, and also local organisations. We do home visits, we do telephone support, and we do a weekly wellbeing walk that anyone's able to come to.
You don't have to have a diagnosis, so we're not just seeing people that, have a diagnosis of depression, have a diagnosis of another mental health condition. Everyone will get offered an initial home visit, so we can just have a chat around what's going on for that person. Most people you find have been struggling for quite some time, so actually the relief of actually meeting one of us and being able to talk through those things, it gives people comfort.
It was the only service, I guess, I looked forward to. The only service that I felt was there purely for myself and my husband. They were there to make sure that we were doing okay, because frankly, if we weren't doing okay, then it was much more difficult for us to take care of the baby.
It felt like having a friend visit, really. It felt like having an auntie come over and provide, some wisdom and some support. She was able to refer me to a group called Mindful Mums. So we would meet once a week and we would talk about different themes and kind of put a name to the feelings that we were having. That feeling of community was really obvious right away. I feel incredibly blessed to have had that access.
So if people don't get the intervention, it can have a real detrimental effect for children, for their physical development and their emotional development.
Sometimes we won't see the benefits of that until that child is an adult and they have been able to grow up in a compassionate, nurturing relationship with their parent, and they go on to have their own children. We are quite a unique service in terms of our support for fathers as well, and actually sometimes they are marginalised.
There's a lot of time when the focus is just on mum and baby. Our son's birth was horrific. We went through a period where it felt very much like I was going to lose my son. Misa then had issues and it felt very much like I was going to lose my wife. Dealing with the repercussions was very, very difficult. You sort of put yourself on the back burner. So having someone externally go, you need a bit of help, was a massive plus. I dread to think where we would be if we hadn't had access to the service in the first place. The service was a lifeline for us.
The blend of experience that we have in terms of maternity, neonatal unit, mental health background, therapeutic background is not replicated anywhere else. What a lot of people say is, actually I wouldn't be where I am today without this service. I may not have been here without this service. This service gave me a space to be able to talk about how I was feeling.
Mums would be suffering with severe mental health issues, and that would have a massive impact on mums themselves, families, and the children themselves.
If it hadn't been for me opening up to initially my community midwife and letting them know that I'd had some panic attacks and that I was feeling really scared, I would have never got this service. And I think that would have completely changed my ability to be a parent. We really wouldn't have the connection with our child as we have today. I think we're just in such a better place. We're both enjoying being parents. We found a balance, and I don't think we would have got to this point if it wasn't for the service.